Let's talk about the dreaded pixie ear. What is it? Why does it happen? And how do I prevent it? A pixie ear is something that can happen after a facelift. It can happen to anyone. A pixie ear is an elongation of the earlobe as it attaches to the face. And as the face begins to relax, like I had talked about before, there's a honeymoon period and things begin to relax as time goes on. If there's tension and there's relaxation, then the ear can get pulled down and elongate along the face, and that is a pixie ear. It is one of the unfortunate complications of a facelift, and it can happen to anyone. The reason this happens is because there is tension on the closure. This can happen to anyone. What I do to minimize this chance for my patients is I performed an extended deep plane facelift. I do a full extended release of all of the deeper structures within the face as well as within the neck. And that takes the tension off of the incisions. And so when I close the incisions, there is minimal to no tension. The other thing I do is I anticipate that there is going to be some relaxation of the tissue. That is a normal component of the healing process. I will incorporate a little bit of extra tissue underneath the ear so that when that tissue relaxes, it's not going to pull or distort the earlobe at all. This means that for most people, if they have an attached earlobe prior to surgery, after surgery, they're going to have a detached earlobe, and that's going to minimize the chance of developing a pixie ear. Because when you put the ear back onto the face and make it an attached earlobe, that is when the tension, or if any amount of tension is along the incision, or if there's any relaxation of the tissue, then that is what is inevitably going to cause a pixie ear.